At the KSMO studios. It's 7 minutes after the 9 o'clock hour begins, and Deb Hobson's made her way in. It's good to see you. Happy Independence Day, a day late.
Thank you.
And you did have a little time off, right?
A little bit of time, yeah. We all get off. Most of us get off the July 4th or any holiday, basically. But sometimes we have to take call, which I did. But it was an uneventful day as far as the hospital goes, so that was good.
Kept you at home and grilling,
Yes.
and just nice
hanging
and
out.
Cool. There you go.
Yeah, nice and cool. Yeah.
Very good, very good. Well, this is obviously been a fairly warm summer too, so we have had some heat issues with
Yes,
some
we
people
have.
too, and people do need to watch out. There are some symptoms of the heat, aren't there?
There is. I mean, excessive sweating, increased thirst. Sometimes we don't hydrate enough, and look at all these activities going on and runners and things like that. It's really important that we stay hydrated. You could become heat exhausted really easily, and then if we're not paying attention, it leads into heat stroke, and we don't want that to happen. So lots of things we should be doing. Hydration is the big thing. Watch for those high temps, things like that when you're out doing things. Get into cooling stations. Make sure you bring things to stay cool.
And everybody is different. Some people can handle the heat better than others.
True.
But just at the parade yesterday, Deb, I saw some people with just brilliant red faces, and I know that they got to be hot. It makes me feel hot looking at their face. That can be a sign too that you're actually overheating or getting dehydrated, isn't it?
That is true. It is true. And you have to be careful because some of those people, whether they're the really young or the elderly folks, on all those blood pressure medicines, things like that, those play a role in getting heat exhaustion a little quicker than, anything could trigger that a little quicker than it would some people that could tolerate it much better that are not on all those things or have those medical issues. But absolutely, the flushed face, the maybe feeling really, really dry, sweating.
Get a little lightheaded sometimes.
Lightheaded, yes, true.
And the sad part about it is that people think that they can bull their way through it,
Yeah.
and you really can't when it comes to heat exhaustion or heat stroke. That's not something you want to play with because obviously it can start shutting down the bodily functions you have
organs,
to have
true.
to make it through the day, and that's just not something you want to go to the hospital with, and they're going to have to try and get these things reactivated, get a whole bunch of fluids in you to try and get kidneys and liver going and things of that nature, and that can be a very scary situation.
It can be very scary. And, we're so used to being in the cool air, the air conditioning and stuff like that. I don't know, you remember when you were younger, we didn't have air conditioning in our
I
home.
know.
So we may have probably tolerated the heat a little bit better than what we do today because we're in that air conditioning and then going out and thinking that we can. But unless you're in it out often, like the farmers are out in it often, they probably know enough to be packing those cool drinks and things like that to prepare for that day out in the field or whatever. But if you're not used to it, then you're gonna become a little exhausted much quicker.
All right, and that's why we try and explain to people on the air when we know we're going to have a hot day. Get out there and get it done this morning.
Right.
As the temperature rises a little, you're okay, but just like you're saying, we're so attuned to the air conditioning of our bodily systems. We're so attuned to 75, 78, maybe 80.
Yeah.
And you walk out in 103 and high humidity, and it's like somebody hits you in the face with a baseball bat. You can feel it, and immediately you start to perspire. Immediately you start to feel wore out.
You do. You get tired really quickly. If there's no air moving, you get that kind of tightness in your chest and think, man, it's just so hot, I can't breathe out here because we don't have any air moving and stuff like that. So.
And we have had some issues with bad air. We have had the fires coming out of Canada that have gotten into our area. Have there been some people coming to the hospital that have had some issues breathing because of that?
Well, this time of the year, we always kind of see respiratory stuff when the weather's hot like this, whether it's too hot or whether it's in the extreme colds. Your COPD patients, your asthma patients, and the pollen and stuff that's been out there early this year. I mean, it's been crazy. I mean, that stuff, and it's still blowing. I mean, you're still seeing stuff out there, and that does affect those respiratory patients probably a little quicker than maybe someone who doesn't have those kind of underlying problems. But Yeah, it's kind of hard. It just hits you like a wall, and you just think, man, I don't know if I can be out here.
Yeah, I know St. Louis has had the air quality at orange quite a bit. I was just up in Michigan where they had it at red at many times, which means they don't want you outside at all. But unfortunately, you still got to go outside, do things, go to work,
Right.
whatever you have to do.
Right.
So you just really want to make sure that if you have issues, breathing issues, and you hear about these fires, it doesn't necessarily mean a fire in Canada is going to be bringing most of its smoke down here.
Right.
It just so happens that we were getting it. So adding that with the pollen, adding that with the heat, and putting it all together, it's just another layer that you may be going
Right.
through and trying to breathe free and easy.
True.
Very good. Well, we've got some other stuff to talk about today besides heat. We've
True.
seen the heat.
True.
Let's talk. What would you like to talk about, Deb? I'm going to leave it up to you.
All right,
Since
perfect.
my
So
guest.
I just wanted to kind of go over some things, the things that I'm kind of monitoring every day. We think the end of COVID has finally gotten here, but not really.
No.
I mean, it's never really going to go away. We have relaxed our masking policy. We don't require anyone to be masked when they come in. We do ask if you have a cough, though, or a fever, or something's going on and you're coming in and not feeling well. We ask that you mask if you're visiting a patient, because that means you're bringing something to the hospital.
Right.
The other thing that I have going on that I've been reaching out to the community to start doing those CPR classes. When COVID hit, we kind of stopped a lot of those things.
That's true.
So the volume on those community classes have increased for me, which is great. I like doing them, and in the month of May, I think I've done about 6 or 7 of them, and that
Good.
doesn't include the employee education that I'm doing every month as well. So, and then I just wanted to bring back up the community blood drive is coming July
That's true.
14th from 9 to 2. It'll be in the doctor's library, the meeting room that we use, and you can schedule an appointment actually for that, and you don't have to sit and wait in line, and you can go to www.cbco.org/donate and schedule an appointment, and then you just come in that appointment time. So there's incentives that they're doing. They're calling a pint for a pint. So from some participating breweries, I probably didn't say that quite right. It could be a drink of your choice. Free T-shirts and free ice cream vouchers for as long as those last. We're doing a little incentive for inside the hospital to get more employees to donate. Our numbers are a little bit low. We used to have numbers up in the 20 to 25 range, and we've been really low in comparison to that. So I'm trying to do a little incentive to get more employees' participation.
Well, and a little bit of that CBCO, they're not promoting it as far out as ahead of time as they used to.
Right.
And that's another problem, because here again, the summertime, people make plans and, well, wait a minute, well, there's a blood drive now? I mean, I got the release actually Friday.
Correct.
Friday is basically the first, it's June 30th.
Right.
Well, okay, if it's going to be, I think the first one is First Baptist Church.
Right.
It's the 11th, and then
July
the hospital's on
11th.
the 14th.
Right.
Well, that's only 2 weeks, and you got a holiday in there. So that's not giving you a lot of time to really get the information out so people can sign up.
True. It's so we did get it, like you said, that last week, or I
Late
know
last
I've
week,
passed out flyers uptown already, and I make sure I go around the hospital, and all the departments have the flyers and notifications and stuff like that. But you're right. With First Baptist having their blood drive on July 11th, those people usually that go to that blood drive, so say you have somebody who can't make it that day, they can come to the July 14th one at the hospital. So when they have them at certain areas, the public is definitely welcome, and we encourage them to come if they can. So if they do one blood drive, they might not be eligible for the other one because of the time in between one.
Right, yeah.
But however, if you do the hospital one, then of course you're coming back to that time frame. So we kind of looked at that. We are trying to do what we can do to bring people in and encourage staff to donate as well. And
Just seems before COVID, there used to be a bigger separation in there. It
Yes.
used to be near the end of the month, I think the hospital was getting their blood drives, and then
True.
First Baptist was usually the second Tuesday of the month all the time.
Yeah.
So I don't know if that has something to do with it.
I don't know what the change is. It's not the change on our part, probably. Maybe availability of the room. I don't know if the community blood drive folks have something going on. I don't know.
Well, they had a big change. Obviously, with COVID, everything changed. It had a big
Yeah.
change over in personnel. And so maybe some of those standing dates that used to be there,
are just not there.
They're not there anymore. Yeah,
so we're thinking about at the hospital maybe just doing it a couple times a year, so that maybe it'll give it some time in between the First Baptist one. This one I didn't even realize that First Baptist was having one July 11th when they gave me the date for July 14th. Okay, but so they get their congregation, so that's what they're getting mostly at First Baptist. So that doesn't affect employees at the hospital or others that maybe don't go there. So that's what they're thinking.
Well, let's talk a little bit about the blood drive. How important is it in the summertime to get people to donate? Because just we're talking about vacations, you usually have, a lot of people that make their donations usually do it 8 or 9 times a year, and they're pretty consistent about it.
True.
You can count on them.
Yeah.
Well, but in the summertime, when everybody's traveling, those numbers tend to be a little bit smaller.
They do. They drop. So maybe it's good to have one a month apart or something. I don't know. I don't know what the answer is,
No.
but
if you'd
it's
like
important.
to give,
if you like to give, it's really important, and we appreciate everyone that does donate and give. And of course, with summertime comes trauma and that kind of stuff, and we need blood just as much or often in the summertime as we do in the wintertime as well. So it's very important. Blood saves a life. We all know that. And
it really does, and it doesn't take that much time. But if you're feeling ill, please don't go.
True.
They won't accept your blood if you're.
And if you've been on antibiotics, I think like a week before, 2 weeks before, you can't give blood also. So yeah, if you know that ahead of time, you don't want to come and give blood then.
Right.
But
so when you do make your appointment, by the way, you can call and make that appointment, or you can
Yes,
go online. They
that's
do
true.
ask those questions, by the way. Are you on medication, and what type of medication is it, so that they can either say yes, you're able to donate, or no, you're going to have to wait until the next cycle to go and donate. Very important to please, if you can, please donate blood, because that's what we're talking about. Maybe some of the regular people that don't normally would give, they're not able to now because they're on vacation, and we need as much blood donated as we possibly can get.
Absolutely.
You know as well as I do, somebody that has an accident and they're losing blood, and you put a pint or 2 or 3, next thing you know, you might be using 7 or 8 units
That's
for
true.
one person.
That's true. That's true.
And then that can suddenly, you watch your supplies suddenly drop. It's just not a good thing.
Absolutely.
So good. If you have any questions about that, can they call you at the hospital?
Absolutely. 573-729-6626. My new extension is 3500.
3,500. We all getting new extensions
Yes,
now?
we have new phones, so everyone's
know.
got a new extension.
I didn't know they had them all working yet or not.
Oh,
I know they
yeah.
had some of them working. Okay, very good. Very good.
I know mine. I may not know someone else's, but I know mine.
3,500. That's Deb. All right, very good. What else would you like to
So the other thing,
keep us up to
I
date
do
on?
this every day. It's called infection surveillance, and so I'm always looking for infections that we may have at the hospital, and when they're on those great big antibiotics, we're looking to get them off as soon as we can. So I'm always looking into that and seeing who's got what and what's going on and that kind of thing. The other thing things that I report: dog bites, cat bites. We've had several this year already, and July 4th holiday, there's 2. So that's always ongoing. That's just
That's
some
not
stuff.
unusual because
No.
dogs are very sensitive, and so are cats, to that bang.
Yeah.
And a lot of kids don't think about it, and they go to reach down for that animal, and a firecracker or something go off. That dog's going to react.
Yeah, exactly. And then for me, basically, that's it. That's just stuff that I do every day. And so I just thought I'd give
Boring everyday
boring
stuff.
everyday
But it's
stuff.
vital for those people. I mean, you're taking a lot of information there. It's a lot of
Yeah,
data.
a lot of
that
data.
You have.
True.
And then you compile that data, and then you put your report together at the end of the day and see where we stand today. And basically, that's what you do.
That's what I do. Yeah, I report all these things to the hospital quarterly. So there's a meeting that I hold, and several of us go to that meeting, and so we report that. But these things are reported daily as I get them to the local health department, and then of course there's data that I report to the state. So I'm always reporting to somebody, whether it's quarterly, every day, or monthly. it's just ongoing every day.
And Deb, that is a misconception I think a lot of people have with the Denton County Health Department and the hospital. They work in tandem all the time.
True.
You know, and if somebody said, well, they don't get along, I said, I never heard that. But,
Yeah.
I know they have to work together for a lot of different things, and there's different things that health department does versus the hospital, obviously, but there's still some data that has to be moved between the two.
Exactly, and they are a great resource for me and I for them. If they're missing some documentation or something they need from the hospital, I'm their go-to person usually. So we have a good relationship. I'd like to think that we do anyways. Every other day I'm calling Trish probably about something because she knows something that I don't know, or or vice versa. So we work with them on different levels. I don't know if you're aware of the healthcare coalitions that are out there.
Mm-hmm.
So we are still a part of the Southwest Healthcare Coalition, and I represent the East Division of that Southwest.
Wow.
So, and
Just something else.
just something else, yeah. So health department's involved in that as well.
Right.
So that's just another resource for us, and another working relationship that we have with them.
Just trying to keep people healthy, and the best way to do that is communication, and
Sure.
that kind of communication vital to keeping people going, especially when they don't know what they have.
True.
If you got a cut, you know what it's a cut. If you get an infection in that cut, okay, you can pretty well know that. But it's these other things that you don't know that become, and I hate to do like surprise, but here it is. And there are a lot of those things out there in our everyday life. We just don't know what's going to happen
We
next.
just don't know. And one of the things I wanted to talk about, we've talked a lot about different types of infections and what we should do to take care of our skin when we get hurt or we have that laceration. But I'd like to put a name to it today. So it doesn't matter if it's a laceration or you get an abscess underneath the skin from an injury or you have a major surgery. Sepsis is something that is very serious. That's a medical emergency. And I'm just going to read a little bit. It's the body's extreme response to an infection causing your organs to shut down one by one and can cause death if we're not paying attention or know the signs. And I've seen this so many times. You'll have a young adult person have maybe a major surgery and they were healthy before, but something wasn't right. Obviously, they had to have the surgery. So when they do well in the hospital, they go home and say they go home and they have a little kiddo at home that had a cold, maybe had a little bit of a temp. They don't now, but and a few days after they're home, they start not feeling well. They sometimes have a tendency to put that off because the kiddo was sick, and they think it's no big deal. I'm going to be able to get over this. I'm just going to kind of wait. And you should never just wait. If you develop a temperature, if you start having extreme pain, if your skin becomes pale, you'll have a loss of appetite. Don't ignore those things because this is a big deal. Sepsis is a big deal, and I can't tell you how many times I've seen that, and all because we think we're going to get over it. We think we can fight this off. It's not because of the surgery they just had. It's because the whole family maybe had a little bit of cold or something.
Right.
And maybe that's the case. Maybe you did develop a little bit of a temperature because whatever one had, the other one's getting. But don't wait 5 days down the road to figure that out. You need to be calling your doctor and seeing them soon. If you can't get into that appointment soon, I always say go to the ER. Because sepsis is something that we need to treat quickly. We need to identify it quickly.
Right.
Because your organs do shut down. You get really sick. You go to an ICU, and you can have those feelings. If you feel like, man, I feel like I'm going to die, because you're that sick. That's sepsis. And we need to do something about it. You need those big antibiotics. And the problem with that is when we wait so long to get to the hospital or to see our doctor because we're having some symptoms we think are just going to go away, we get readmitted to the hospital. And you're more likely, if you have sepsis, to have that readmission 30 days after a discharge from a hospital, another readmission. And you're looking at maybe being there 30 days. And then, of course, being in that hospital, if you thought being in the hospital for surgery was long because you had to be there for 7 or 10 days, because it was a major surgery or
Sure.
whatever, you know what it feels like to be in the hospital, not be at home, and not have all that family contact. You get a little depressed sometimes, but if you have that readmission, you're going to be there longer, because sepsis is a big deal. You may end up in an ICU. That just extended your hospital stay. And it's frustrating. It's frustrating to the person who was maybe a healthy individual, and they thought they could just kick this, I guess.
Well,
So
we're all super persons, don't
yeah,
you know
we
that?
are. We are.
No, we can all get, and I think that starts when we're younger. Oh, it's just a cut, or it's just this, Don't worry about it. It'll go away. Well, if it doesn't go away in a short period of time, you've got an issue. And we were talking before we came on the air. My brother ended up with sepsis and an infected knee. He didn't have any surgery. He didn't do anything. How it got infected that badly, doctors didn't know, but they do know one thing. When after he passed out and they brought him to the hospital, they only gave him a 20% chance of making it because it already had gotten into his
Right.
system. It was already starting to affect his organs. You have to get, they gave him, what do you call it, a truckload of antibiotics, whatever it is. It is
You're on big antibiotics,
big time
like,
antibiotics.
like vancomycin and
Right.
cefepime, and sometimes even Rocephin. That's one they can give IV as well, but there's others out there that we use also.
Right.
So, and those antibiotics, to be on them for a long length of time or period, are hard on your organs as well.
Sure.
You have to really watch your kidneys and stuff like that. So we don't want you to be on those antibiotics for a long period of time. But if we have to use them, we have to use them.
Right.
Because once you get sepsis to that point, you have to use them.
You have to use them.
You
And then after a while, when he was able, to get he did come back. He was able to make it through there, but then they had to go and take that infection out of the knee. They can't do it while they're feeding him all the antibiotics. They have to get his, I guess all his readings have to be good in the blood to make sure they can actually go in there. And then they found out, they were draining brown fluid out of his knee,
Yeah.
which just shows that's pretty nasty brown gray fluid. And of course now, not only is he doing that, but then he has to go and they have to do surgery on the knee to clean up whatever the problem was.
Right.
So he ended up being in rehab for almost 5 months because of that situation. So you don't want any of that to happen to anybody.
And that's true. And I've seen things happen like with amputees, that wear those prosthetics. After wearing them for a while, sometimes you get that callus, that blister on there. But if you're not careful, if you don't watch them really close, you get a little bit bigger blister and it gets red. And if you're diabetic, healing process is slow. And sometimes that requires going to the doctor and getting antibiotics, and the longer that goes and untreated, the risk is sepsis. I've seen people come in where they can't eat. They were fine just a few days ago, but when they go to eat, they can't hit their mouth with their spoon. You'll see differences
Wow.
like that. They'll have temperatures. They'll have shivering or extreme pain, like I said, and they can't think. When they stand, they're not steady. I've just seen this several times, and if we could have treated early, we wouldn't get to that point. But once we get to that point, it's just downhill from there if we don't get a handle on it. So,
And how much does age play in the rapidity of sepsis? Or is there no real gauge on that?
It says those highest at risk for sepsis are children less than 1 year old, elderly greater than 60 years old, those with chronic conditions or weak immune systems, and those with wounds or surgical incisions. So those people, we definitely, doesn't mean that anybody couldn't get there,
Sure.
but those are who are most at risk for sepsis. And if you've ever had sepsis and been a sepsis survivor, then you're at increased risk for that happening again.
It's still in your system.
It's still in your system. Yeah.
Just because you had that cocktail of antibiotics doesn't mean it eliminated it. It's still there.
Yeah. And sometimes you don't know where the infection's coming from. You come in and you have some of these symptoms and your white count's really high. then they're doing those cultures, those blood cultures and things like that to figure out where it's at and what it is that's growing and what we got to do. But, we got to get those things done quickly and get those done so we can start you on those antibiotics. And sometimes we're starting you on those antibiotics before we have any of those results back because we got to treat what's there, what we see.
Start
what we
right
see.
now.
Yeah. So some of the signs of symptoms is shivering, extreme pain, pale skin, sleepiness, or the feeling that I feel like I might die. When you get to that point, it's pretty bad.
Yeah, well.
It's pretty bad. And again, sepsis shuts down your organs one by one. It just starts shutting them down. Your kidneys aren't functioning just like they should be. You're not putting out the urine output that you need to be putting out. So you get dehydrated. Like I said, you don't want to eat. So don't ignore those things. And I used like a surgical patient for an example because those people that go in pretty healthy, feeling pretty good, knowing they get done what they got to get done, go home, and they're going to bounce back. Don't get over anxious when you get home and feel like you got to do everything. Give yourself time to heal. That doing things too soon could trigger something.
Sure.
But just don't ignore the symptoms. Sometimes I just kind of feel blah, or you don't think it's anything. It could be something.
Sure.
Don't wait for it to get worse before you follow up.
Right, especially if you have surgeries.
Correct.
You got to let the body heal, and a lot of times it takes some strengthening exercises, but don't overdo it because then you tax the body too hard, and a lot of times, well, we all know, Deb, there's some internal stitches here or there.
Yeah.
Might be something in there. If you've gone and gotten your knee scoped, a lot of people say, well, I've got my knee scoped and scraped out. Okay, let it heal. I mean, there could be inflammation around there for a few days. Let it heal. Don't go outside and all of a sudden say, oh, I got to go cut the grass today.
Yeah.
Probably not a good idea.
Not a good idea.
But let's just lay it on the line. You got to be aware of what your body is telling you.
True.
So if something isn't normal, whether you have sepsis or maybe you've got COVID or maybe you've got another infection that's affecting you, or maybe you've gotten bit by a tick. Nobody knows why you're getting that way right off the bat.
True.
You have got to, but if you're not feeling right, if you're overheated, we talked about heat exhaustion, things of that nature. If you have heat exhaustion, you've got sepsis, you probably don't have a chance because you're not going to get enough fluids in you to keep you alive. That would be a really bad situation. We don't want that to happen to anybody. True. But you have to read your body. And if your body's telling you, I've got pain here, I should not have pain here, or maybe you're getting a whole bunch of cramps all of a sudden. Don't know why, but you are. And you haven't done anything different. Lose your appetite, like you mentioned. Sometimes unsteadiness is also a good thing because if your bodily functions aren't working right, you're not going to be stable. True.
And it makes it hard. It makes it hard not just for you. It makes it hard on the family that's taking care of you or helping you, or and maybe, I don't know, a little bit more difficult for the caregiver to figure out what's going on.
True.
Lots of things are involved. But the best thing is to recognize that it's a medical emergency. We need to recognize it early, and we need to treat quickly.
So if things start getting a little out of whack this summer, it really is not hard to see that something's kind of going awry. And maybe you're thinking, it's just so hot I don't want to do anything. Well, okay, I get that. I think we've all been there before.
Yeah, that's true.
I really would not want to go outside 110-degree heat and work all day. No, I don't want to do that. I have in the past, but that's not probably the best solution. But use a little bit of common sense. If your body's telling you that I'm not reacting the way I should, make an appointment or even just walk into the clinic, get some attention.
Yes.
Get it now. Let them run some tests because you won't know by looking at yourself in the mirror. It's the same old me. You may not see yourself being flushed. So you walk in there and somebody says, man, you look pale. You may not see it.
That's true. You may not. I mean, especially if you've been outside working or whatever. And you're right, those tick bites that you get the tick fever with, I mean, you can easily think that you're just tired and exhausted from being outside working all day, and it may not be that at all.
No.
So, and of course, eventually you're going to know that because that doesn't get better. That gradually you get to feeling worse and worse, and then you realize, oh, I really don't feel right. This is not right. So
And then you think you can just sleep it off, but it's not. It's not
it doesn't
solving the
happen.
problem.
That's true.
You're not solving the problem. And you can easily make an appointment at the clinic, 729-8000. Get over there. A lot of good physicians. Physicians are really, they're going to be the best way. You're going to take a lot of tests, obviously, when they get there. If they don't know what it is, if it's not
That's
super
true.
obvious,
That's true.
they will take those tests just to find out and get it isolated down or eliminate. As I always watch CSI, we're taking your fingerprints to eliminate you from being a suspect. Well, basically, they do the same thing with a blood test. They take the test and see what the
To
results
eliminate.
are to start eliminating
To start
things.
eliminating
That
things, correct.
it's not. It's not
Correct.
this. It's not this. It's not this. But if they come out with a high white blood count, you just may have a
Something's
problem.
going on somewhere. Yeah.
You've got an
That's
infection
true.
somewhere, and they need to do it.
That's true.
And we have a great staff over there. Remember, the clinic is open 6 days a week. Obviously, Monday through Friday, they're normal times.
Normal
and
times.
It's at 8 to 6, right?
On Saturday?
No. Monday
Oh,
through Friday.
Monday through Friday.
8 to
yes,
6,
they're
right?
open from 8 to 6.
And
Correct.
and on Saturday, it's 9 to 2?
2, yes.
Okay? And that's a walk-in clinic.
It's a walk-in clinic.
You're more than welcome to just walk right in and say, hey, I'm just not feeling right. They can get those tests run and then come back. And, if nothing else, Deb, it's peace of mind.
Yes.
If there is nothing wrong and you say, well, maybe it is just the heat, and they can tell you, hey, you need to drink more water. More than likely, I guarantee you, they're not a doctor I know today that doesn't say don't drink more water, which is a good idea.
Correct. But there, there's tests that show that how hydrated you are. I mean, your kidney function test. We can look at that and see if it's higher than what it should be. And usually that's the reason, is because you're not drinking enough water. And water, I know it's not the cure-all for everything, but water's what makes your organs work. It's what makes
Right.
your liver work. It's what makes your kidneys work. So, that's a good tool for us to use.
Very important. Be aware of what your body says to you. We talk about it all the time, but it is true.
It is true.
It is true. So
is
here in
true.
this summertime where we have hot conditions, make sure that you understand. And as we get older, of course, none of us get older, but as we do age a little bit, you may not have that same propensity of being out of doors as long as you used to when you were 25 or 30 years old. You might get tired a little quicker. You might not be able to work as hard. I used to do outdoor maintenance when I was in my late teens. I used to work 10, 12 hours outside.
Yeah.
And you're drinking water and you're going, but you just keep going and going and going. Well, I was 18, 19 years old. You can do that.
A little bit different, huh?
And you get 60 and you're not as active anymore. Your metabolism doesn't move as fast. You still need the amount of water you have. You still got to have that water going through your system. It's just when you were 18, 19, maybe you perspired a little bit heavier. I don't perspire like I used to. I used to just sweat crazily. I had to drink a lot of water, but now I don't sweat as much, but I still need the water.
Well, that's true. So, and if you're somebody that does sweat a lot, you know that you're getting rid of that water. So, keep drinking the water. I'm not saying you have to drink gallons and gallons a day, but, just
Constantly
if
be
you-
sipping water. You don't
Yeah.
have to take big gulps.
Right.
Just constantly sip. And in the case, and I've told this to a lot of people, and I don't know if everybody does this or not. I know when I cut grass, and I've got a lot of different grasses to cut, first thing I do is, because of all we've talked about up in the air, pollens and everything else, as you're cutting grass, and I don't like to wear a mask because it's really hard to breathe in some of the areas that I'm at. If you do know wear a mask, still want to do this, take that first sip of water, slosh it in your mouth, and spit it out.
Yeah.
Don't want to have to swallow all those allergens if you've got a problem.
That's
It
true.
just puts it into your system.
That's true.
So slosh it around, and then spit it out. Then take a nice, cool sip of water. Not ice cold. That'll burn going down, and then you won't want to drink any more water.
Yeah, that's true.
So take a little sip and let it warm up. In your body's hot. It won't take long for it to get to
warm
body
up, yeah.
temperature, and then do that a few times, maybe 5, 6 times. Put the water down and go do something else, and then as you feel that need, do the same thing. Slosh it, spit it out, and take a
Yep.
few more sips.
Yep. Or if you get too hot, try to get out of the heat for just a little bit. Give yourself a break. So,
I always told people, if you're going to be working outside, if you're not going to be near an area where you have shade, number one. Number two, water. Because there are areas that we all know out in the middle of a farm. If you're out in the middle of a field, you don't have a spigot right there that's got water. Take a cooler with you. Have water in the cooler, but also have a couple of towels with you. Because you can get that water, pour that water on a towel, damp it down. And not ice, by golly, you don't want to do that, but put that around your neck, armpits.
Yep.
We all know, do not put ice cold water over your chest. You don't want to shock your heart.
Nope.
But just do that, and it will cool you down across your forehead. True. It'll cool you down slowly.
Yeah.
Don't want to do that in a big hurry. That can be a bad thing too. So
it could be, yes.
Yeah.
And I've seen some people, they'll just take their bottle of water and just, if it's not ice cold water, you can do that.
Right, yeah. If you've got a cool water, just maybe tap water, you can definitely do that for sure. But ice water, sip it. Don't try and guzzle it. It can. You've guzzled ice water before?
Yeah.
But haven't we all? And you get that burning sensation.
You kind of do, yeah.
Yeah, because
you do.
Your body is hot and all of a sudden cold, and then your throat's like, wow.
You kind of have a little pressure there.
Yeah. It's like, wow, what are you doing to me, dude?
True,
anyway,
true.
But I truly believe in what you're telling me. Sepsis is such a scary thing, and I hope people do take heed to kind of what we talked about today. And I almost lost a brother because of it, and I'm very fortunate. He's still around, but it was very scary. And you don't realize it, and somebody says, oh, I got sepsis, not a big deal. Well, yeah, it's a big deal.
It's a very big deal. If you've ever helped take care of someone that becomes a little confused, but just enough alert that they're difficult to care for, they're difficult to manage when they're in that state. So I don't know how to explain that, but I just, personal experience, I've been there, so I know.
Well, I think all of us think we know what's best for us.
True.
And so when you get confused, you're denying. It's kind of like the denying factor. I'm not sick. I don't have this. Go away. Leave me alone.
Yeah, and we all do that a little bit. We get a little bit of a cold or something, and sometimes we're right. Sometimes it'll just go away on its own, and sometimes it doesn't. And we're just a little bit hard-headed because we're always trying to justify, I guess, or say, oh, this is what it's from. It'll be fine. It's really not because of this or whatever. But just really pay attention to your body, and what doesn't feel right, what you've experienced before, and what's not right or what's new now.
Yeah, if it's something different, don't play with it.
Yeah.
Get checked out. 729-8000 is the number to the clinic at the Salem Hospital. If you have an immediate need, call 911. Don't play with things. Let them come out and get you, because they're going to start doing tests right away. And they will find out if there's a problem there. So especially if you've overheated, do not try and say, I want to jump in the car, turn the air on, and drive. That's not a real good idea. If you've got heat exhaustion, you might be able to get by with that, but I still don't recommend it, because you might be a little bit bleary-eyed and get a little bit confused like we talked about. Last thing you need to have is some child come in front of you.
Dizzy-headed, lightheadedness you might experience with heat exhaustion.
Call 911 and get over there. If you become totally disoriented, you definitely call 911. You don't even want to play with that stuff. But again, be aware of the heat, but also be aware of how your body talks to you, whether it be heat or infection or something else. If your body's talking to you, do listen to it a little bit, because it's trying to tell you this isn't right.
And you know what? Sometimes I think we really do know that it's different, that we feel different, but we still want to just try to push past.
We're all super people.
I know we're super.
Deb, thank you very much
welcome.
for coming in. Again, why don't you give your extension in case somebody has a question? 729-6626, 3500.
3500.
And make it. That's a pretty easy extension,
It
actually.
is.
You got pretty fortunate.
Yeah, I did.
Well, very good. We always appreciate Deb coming in and spending some time with us. And our spotlight on SMH, we do appreciate everybody. And if you have any questions, contact your hospital, or also contact the clinic. And if you have questions about your health, get to see a doctor or a nurse practitioner, somebody who can help you and get a good idea of what is bothering you so they can treat it before it gets out of hand. Thanks again for coming,
You're
Deb.
welcome.
Appreciate you. Keep it here, KSMO Radio. We'll come back with Civic Happenings in just a moment.